The topic that I'll be talking about today is FGM culture. So, what is FGM? FGM is the female genital mutilation, and it involves the partial or total removal of external female genitalia or other injury to the female genital organs for non-medical reasons. The practice has no health benefits for girls or women, and procedures can cause severe bleeding and problems urinating, later cysts, infections, as well as complications in childbirth, and an increased risk of newborn deaths. FGM is mostly carried out on young girls between infancy and age 15. My overall thesis for this presentation is that there are American practices that are definitely comparable to FGM culture in how Tamir approaches it. So why is FGM culture important? A lot of people in America view American practices as normal and acceptable in society. But just because something is acceptable doesn't mean that it is not a harm. So through class, we talked about a reading called Hands Off Clitoridectomy by Yael Tamir. And she is an Israeli academic and former politician who served as a member of the Kinetic for Labor Party between 2003 and 2010, and as a Minister of Immigrant Absorption and Education. So in the reading, Tamir says, references to clitoridectomy, or FGM, commonly reveal a patronizing attitude towards women, suggesting that they are primarily sexual beings. Moreover, those references involve a certain degree of dishonesty. They intentionally widen the gap between our culture and those in which clitoridectomy is practiced, thus presenting those other cultures as incommensurable with ours. So basically, she is talking about the deeper wrong of clitoridectomy and how the social equilibrium plays into that, as well as a violation of consent. So her main premises for this argument is that FGM is a morally indefensible cultural practice. FGM is relevantly similar to some practices in American culture, and therefore some practices in American culture are also morally indefensible. So my first example of something in American culture is the BBL surgery. So the BBL surgery is the transfer of fat from thighs and stomach to someone's butt to create an hourglass figure. It has the highest rate of mortality in all plastic surgeries, and despite the risks, it is still the fastest growing procedure in plastic surgery. I wanted to focus on BBL surgeries because they are popular amongst celebrities and non-celebrities alike. So pictured here is Kylie Jenner. And although women might think that they're getting a BBL surgery to make themselves look better, it is really appealing to the male gaze and what society thinks is the ideal body type. And the social punishment of this could be that not being able to get married or have a boyfriend because you don't look a certain way. It also might make someone feel bad about themselves because they're not beautiful enough or up to the standards of society's norms of beauty. My second example from American culture would be the husband stitch. So the husband stitch is an extra stitch that some women say they've received during the repair of a vaginal tear after childbirth. There are no benefits for the woman, and it has no approved medical use or benefit. So the husband stitch is seen as a form of FGM because it's doing something to the female genital region that is changing it in some way. The only reason why someone would get the husband stitch would be for the benefit of the husband and not for the woman. And it violates consent because the woman is almost never asked if this is a procedure she would like, and it proves Tamir's idea that women are just here for men's sexual pleasure. A social punishment of not getting the husband stitch would be that your husband or significant other could potentially leave you, and this is all because of what society has thought, so they have a specific idea, look, and feel of what female genitalia should be. In conclusion, FGM culture is comparable to common American medical practices because of the similarities of the oppressive social equilibrium as well as how they systemically violate consent. Just because these American practices are seen as normal in society, it doesn't make them not a harm. The deeper harm is the social equilibrium as well as the systemic violation of consent.